Today we are covering chronic obstructive pulmonary disease, or COPD, a topic the NCLEX loves to test by focusing on priority actions and patient safety. The exam will often blur the lines between its two main types, emphysema and chronic bronchitis, so you must know the difference. Picture the classic emphysema patient, the pink puffer, who is thin with a barrel chest, works hard to breathe, and often uses the tripod position to help. They maintain a relatively normal oxygen level by puffing, hence the pink color. Now, contrast this with the chronic bronchitis patient, the blue bloater, who is often cyanotic and edematous. They have a chronic productive cough from excessive mucus, which obstructs airways, leading to hypoxia and hypercapnia, giving them that bluish tint. The NCLEX will give you a scenario with a patient in acute respiratory distress and ask for your first action. For a patient with COPD, your first move is often not to apply oxygen, but to sip them up in a high Fowler's or tripod position. This simple act uses gravity to improve lung expansion and is always a safe first step. The biggest exam trap related to COPD is oxygen therapy. Remember that for some, but not all, COPD patients, the primary drive to breathe is a low level of oxygen, known as the hypoxic drive, rather than a high level of carbon dioxide. The exam will present a scenario where a well-meaning nurse applies a high-flow non-rebreather mask at 15 liters per minute to a conscious COPD patient. This is a red flag. This action can potentially knock out their drive to breathe, leading to respiratory arrest. The correct approach is to use a low-flow device like a nasal cannula at 1 to 2 liters per minute, or a precise device like a Venturi mask, titrating carefully to maintain a target saturation, typically between 88 to 92%. Pharmacologically, you must know your inhalers. In an acute exacerbation, the priority medication is a short-acting beta agonist or SABA, like albuterol. It provides rapid relief by opening the airways. Long-acting beta agonists, or LABAs, and inhaled corticosteroids are for maintenance, not rescue. An exam question might list several prescribed inhalers and ask which one to administer first for a patient with wheezing and shortness of breath. The answer is always the SABA. Patient education is another critical area. The NCLEX wants to know you can prepare the patient for discharge. Focus on nutrition, telling them to eat small, frequent, high-calorie, high-protein meals to avoid getting tired while eating. Advise them to drink at least 2 to 3 liters of water daily to help thin thick mucus, making it easier to cough up. Teach them pursed lip breathing, which helps keep airways open longer to expel more carbon dioxide. To help you remember key teaching points, use this phrase: COPD patients need calm, oxygen, pursed lips, and diet. This emphasizes a calm environment to reduce anxiety and dyspnea. Careful oxygen administration, the crucial pursed lip breathing technique, and the importance of their specialized diet. Master these concepts, especially the oxygen trap and priority of interventions, and you'll be prepared for any COPD question the NCLEX throws at you.